Okay, hi everyone. I'm Jamie-Lee from One Door Mental Health. If you don't know, One Door Mental Health helps people living with a severe mental illness, in particular schizophrenia, bipolar, psychosis, severe borderline personality disorder, severe obsessive compulsive disorder, as well as post-traumatic stress disorder. We help by providing an inclusive community. We have clubhouses all around New South Wales. We also have innovative services and programs, particularly for those who are in underserved areas, Western South Sydney and rural New South Wales. We also do a lot of advocacy work for those living with a mental illness. So today I am with Philippa Boss. We're going to talk a lot about physical health and how it relates to mental health. So to start with, Philippa, tell us what you do at One Door.
Hi, I'm Philippa. So my role is Physical Health and Wellness Co-ordinator. So that involves looking after a variety of different physical health programs that we have on offer. So the New Moves program, which is our healthy lifestyle program, where you would participate 2 hours a week in some exercise, preparing a healthy meal and doing a discussion topic around physical health or something to do with recovery, such as maybe resilience. We do smoking cessation programs, so we run tobacco free, and that's where we support people to reduce their smoking or to quit smoking. And we do sports camps, so we take people away on camps for a week, and we participate in different sporting activities like archery or basketball, swimming, high ropes activities, kayaking. And we also just run the Mental Health Sports Network, where we run a variety of different sporting come-try days, such as basketball, soccer, throughout it. And so all of that is put into what's known as our healthcare service. And within our healthcare service, we have a variety of different allied health professionals. So we have psychologists, exercise physiologists, and dietitians to help support people with a mental illness. And I suppose one of the biggest things within our healthcare is that we do pride ourselves on being the specialists in people with psychosis or psychotic disorders, so specialising with people that have like schizophrenia or schizoaffective disorder.
Yeah, awesome, excellent. Pip, tell us a bit about why physical health is important, particularly in relation to mental health.
Yeah, I suppose in psychiatry we treat the mind and body separately when they're actually one. So there is no separate things. The body is one thing. So there's no mental health, there's no physical health, there's only health. And within health we should be treating the mind and body as one. And people living with a severe mental illness die on average 25 years too early. So their life expectancy is reduced, and the tragic part of this is that the life expectancy gap is actually increasing, not closing. So over my short career span of 10 years, it's increased. So I sort of sit here and think, well, where are we going to be in another 10 years' time? Hopefully we've made a massive difference and have reduced it rather than it's still increasing. So it's pretty bad and as bad as Aboriginal health, if not worse.
Yeah, absolutely. And a holistic health approach is so important overall. Yeah. What are some common physical problems that you find in relation to mental illness?
Yeah, so they're all physical health problems or lifestyle diseases, which are preventable if we can catch them early and detect them early. However, our screening rates are poor across mental health in some services, and which is probably contributing to the reason why we've got the premature death rate. But many antipsychotics and antidepressants have a stimulating effect on a person's appetite, so they'll make them want to eat more, and as a consequence, people do find that they have trouble reducing how much they eat. They increase a person's weight, and this is a lot of the weight increase is done in their early times of starting a new medication, So if we can prevent it through good physical health, we can maintain that weight gain so it doesn't get as bad over the many years when they're on medication. And we know that these medications, which are called psychotropic medications, so antidepressants and antipsychotics, actually do promote high cholesterol. So there's it's a variety of things interplaying with each other. It's not just one thing. So a combination of the medication, which is promoting some of these physical health conditions, but then as a result, if they're too sedating, we don't have that energy to do the exercise and live that healthy lifestyle we want to. So we need to try and do that. So the main ones, I suppose, are high blood pressure, high cholesterol, type 2 diabetes, and metabolic syndrome, which causes the driving force for that cardiovascular event, which is what most people die from. So, a heart attack early on in life.
Just going back to the antipsychotic part, there is a big debate around antipsychotics and their place in treating mental illness. What is your thoughts about that, and can it work with a holistic health approach, which you've spoken about?
Yeah, it can. We need to be taking the medication because without the medication, we sort of can't have the recovery. So the medication is there to help ease the whatever symptoms positive that they're experiencing. So that's going to help relieve the voices, the different delusions or hallucinations they may be hearing. And then once we've got that under control, we can then start to integrate healthy lifestyle stuff. So just moving, like it doesn't have to be exercise planned per se, it's just getting up incidentally and moving more each day, rather than using the remote control, get up and change the TV channel. Rather than using the dishwasher, do the washing up old style way. So to an extent, society has played an influence on it. But we definitely need to have the medication happening and then the lifestyle stuff around it.
Absolutely. And so when we talk about physical health, I guess a lot of us think straight away about exercise, but it's not just that. How important is stuff like nutrition and sleep in helping someone with a mental illness?
Yeah. So it's really important because everything's actually interconnected or interrelated. So for example, if we look at diet, our body produces cholesterol in the liver, but the foods we eat is what's going to raise that cholesterol level. So, we need cholesterol in the body, but we need it in good normal amounts. And it's that exercise and the diet that's going to maintain those levels of cholesterol at a healthy level. And going to McDonald's every day is probably not a good thing because it's going to elevate those bad cholesterol levels. And then if we're on medication that's already promoting high cholesterol levels, you've got like a double sword coming at you type of thing.
Absolutely.
A double whammy. So sleep is really important as well because it's how our body naturally recovers. And I suppose when you're becoming unwell, a lot of people struggle to sleep. So if you've got some insight into your sleeping patterns and can recognise that, you can take some steps to help with your recovery.
Wonderful. So what about, I know One Door has the tobacco-free and the quit smoking programs. Can you tell us a little bit more about that and how this helps somebody with a mental illness?
Yeah. Smoking's a bit of a taboo topic in mental health for everyone. There's staff that don't want to go there. There's sometimes clients that don't want to go there. And historically, it's been seen as a treatment within itself, within psychiatry. Back in the olden days, nurses would light cigarettes for them and things like that. So it has changed a lot to where we are today with New South Wales Health smoke-free policies where you cannot smoke at all on the hospital grounds. So, there are a lot of myths around there, but a lot of those myths need to be challenged because they're not real. So we know the evidence is showing us that people do want to quit smoking, but people need the support to quit smoking. So they need the staff support. They also need support through being able to access nicotine replacement therapy, or what's known as NRT, and that can be done through GPs. But we need funding at the moment for that NRT to keep it going in mental health facilities. And depending on where you get your treatment, they've got different barriers to accessing that NRT. But very, very important, because we know that smoking rates are 4 times higher than the general population. But in saying that, we do know that they want to smoke. So there's people smoking up to about 30 cigarettes a day. So if you look at, and then if you look at what they may be earning a fortnight, if they're on the disability support pension, most people may replace food and with cigarettes and things like that. So it's, it doesn't just impact physically, it impacts financially, and then it impacts on different aspects of their life as well. So what we do with tobacco free is we can do a one-on-one, or we can do it in a group setting, and we go through and talk about different things such as triggers for smoking, what you can do, setting up a plan, what are different supports that you can access, and help them get that NRT that they really need to have a long-term success at it. But the key word, I think, is long-term, because it does take a very long time to reduce people down to even 10 cigarettes a day from 30 cigarettes.
Absolutely, it's a big lifestyle change.
Yeah.
Cool. And so going back to funding, how do you access physical health assistance with this new NDIS and getting an NDIS plan? And the sports camp you talked about earlier, can you get on the sports camp through NDIS?
Yeah. So I suppose the biggest thing with your NDIS is at that planning meeting when you're going in for it. You need to use those words, health and wellbeing. You need to have a goal around health and wellbeing or physical health to be able to get the funds in your NDIS plan. So, and in your NDIS plan, you can only access like a dietitian or an exercise physiologist or personal trainer using that health and wellbeing support category item. So very, very important, number one, that you use that terminology that the NDIS want to hear, health and wellbeing, and you want to use that towards, to see a dietitian to help reduce your weight or get your physical health under control. And then hopefully when you get your plan, it has that in it. And then from there, you can go to the service provider you want to use to get that service. So within One Door Mental Health, that would be our healthcare part. So you would contact us through our 1800 843 539 number, and then from there we can put you through to healthcare to help you access a dietitian or exercise physiologist or any of our health programs that I run, such as Tobacco Free or the Sports Camp. And same sports camp, we have up under a variety of different things within a person's package. So we could access it through their core support items, or there's various other numbers that we can access it through.
Amazing. And now Pippa's actually doing her PhD as well. So tell us about your PhD research and what that involves.
Yeah. So it's on health literacy in people that have psychotic disorders. So what we've done is we've designed this booklet which takes you through a variety of those health conditions that we have talked about today. So we talk about the lifestyle risk factors that are going to increase your risk of getting high blood pressure or high cholesterol. So for example, sleep, exercise, nutrition, substance use. So, and that could even be, how much caffeine you're having as well, because if you have too much caffeine, it can also affect your mental health. And we talk about ethanol, which is the chemical form of alcohol. And then we go in and we educate people around those physical health conditions so they know the medical terminology. So for example, hypertension is just the medical term for high blood pressure. and then we talk about high cholesterol, diabetes and metabolic syndrome. So the idea is to give them some basic level knowledge around each of those illnesses, and to get to know the key numbers that they need to know that are in the normal levels and the high levels. So when they go on to talk to like a GP or an endocrinologist who's the specialist in diabetes, they've sort of already got the understanding of jargon that they may use, and we let them know that jargon, because we know that health literacy is quite poor across the whole world really, but in Australia 60% of Australians are low in health literacy. So it's really about teaching them the key skills they need so that they can take control of their own physical health. And we've developed this thing called the GP Wallet Prompt Card as well, that they can use and take to their GP to help prompt the GP about those physical health checkups that we know they should be doing, but sometimes aren't doing. So, your high blood pressure, your waist circumference and your blood tests, and talking to you about these lifestyle things so that we can prevent them.
Awesome. And Pip, it is almost the end of the year, so tell me, what is your New Year's resolution?
I don't know, probably trying to do more fun runs.
Absolutely, that's a good one. So, if no one has any more questions, we will wrap it up here. But just to let you know, we just spoke a little bit about the NDIS and the funding and how important it is for mental health at the moment. So One Door is kicking off their Christmas appeal today. So if you would like to help us out, it is critical for the support we're trying to provide for people living with a mental illness. You can do that through our Facebook. You'll find the link there. And let us know any questions you'd like to see on our little Friday Live series. Next week we will have Jane Randall, who's our clinical director for psychology.